Planning for healthcare costs isn't just a retirement conversation, it's a lifelong strategy. I'm Julia Fuentes, Financial Planning and Coaching Senior Specialist. In this video, I'm going to cover how to help clients prepare over time, key enrollment periods to watch for, and the difference between Affordable Care Act and IRMA for Medicare, Modified Adjusted Gross Income, two important terms that can really impact your clients' costs. What you're looking at right here, this is how we as financial advisors can help clients plan over their entire lifetime. It's not just helping them in the decumulation phase. As they're in the accumulation phase, this is when clients start working. They have access to investment vehicles such as health savings accounts. And if they save in their HSA and they understand how to use that as an investment account, it can really help them later on when they're in the decumulation phase. Marriages, children's, divorces all play into this. As an advisor, we need to lean into these life events. Oh, there's going to be a child. Let's talk about their health care. And hey, we're going to make sure we want to add them. If there's a divorce, hey, what are you going to do for healthcare? Is that part of it? Our clients, when they're in these periods of stress, they don't always think about it. Now, when our clients say, hey, I want to retire at age 55, you have to ask the question, what are you going to do for your health care to bridge the gap until you're age 65 and Medicare eligible? Discuss those options with them. Start planning for long-term care and the risk of long-term care costs early. Some people wait too long, and by the time they start thinking about it, they're ineligible for some of the insurance products that they could have gotten at a younger age. Because now when we transition to the decumulation phase, we might have a healthcare event. Maybe we have to go into a nursing home. Our spouse dies. I know for myself personally, if my spouse dies, I lose my health care coverage and I have 30 days to get something else. Make sure your clients know what happens in these life events, and we can really help them plan and be financially secure. So I would encourage you to use your financial planning tools to gather information. Make sure we understand our clients and what their healthcare goals are. You might have a client that, hey, they have a goal of, hey, my mother is really aging and I don't want her to go into a nursing home. I want to take care of her, but I'm going to have a home health aide come in and help me with that. And that comes with a cost. So you want to understand what they're doing, budget for some of these unexpected medical expenses, and think about this over their entire lifetime. Understand their family health history, their dependents, and their plans if something goes wrong. Another important thing that many people forget to do is to get our legal documents in order. We want to make sure that we have, our advanced directives for medical, who's our healthcare proxy, and who's our financial power of attorney. Advisors can really help their clients avoid big mistakes by getting their affairs in order. Now, when it comes to enrollment periods, this is where advisors should have a plan for the end of the year. How are we going to do outreach to our clients to help them avoid mistakes and to really lean in and show our value that we care about both their wealth and their health? When it comes to our working clients, at the end of the year, we have our open enrollment for healthcare, where this is the one time a year that you can change your health plan. You can sign up for those high deductible health plans with an HSA. This is where we can bring on a lot of new clients. I have some advisors that they work with an executive of one large organization and they really lean into the benefits. They understand all the benefits and how it works, and then they prospect to try to work with other executives from that same firm. Because Even if your employer is giving you packets of information, it's still confusing, and an advisor can help sort through some of these aspects. When it comes to the Affordable Care Act, so think of this as your early retirees. I'm going to retire before I'm age 65. Think of this for your small business owners. Oh, I'm a small business owner, a sole proprietor. Where am I going to get my health care? Oh, the Affordable Care Act. Open enrollment is November 1st until December 15th of each year. This is where they get to choose their plan going into the next coverage year. So something that we want to focus on there, get ahead of. A lot of our clients are going to need to ballpark their income for that following year. We can help them with that. And then when it comes to Medicare open enrollment, that's October 15th until December 7th. This is the one time a year for your clients that are enrolled in Medicare already. They can change their Medicare Advantage plans and their Part D drug plans. And we need to help our clients do this and nudge them to do it, because sometimes your drug was dropped from the formulary, and if you don't change your drug plan, you're going to pay an extra $6,000 for that prescription drug next year. Maybe your doctor left the network of Medicare Advantage, and if you don't change your plan, you can't go to your doctor anymore. So we really want to pay attention to these open enrollment periods, and also pay attention to special enrollment periods. When we have life events, our clients get laid off, making sure they know time is of the essence after these life events to get enrolled in our healthcare. Otherwise, we can get into a bind. When it comes to the Affordable Care Act and Medicare, you'll notice that they're a little bit different in how they do the income-based planning for healthcare costs. So let's start with the Affordable Care Act. So the Affordable Care Act, if you go out to healthcare.gov, you select the state your client lives in, it'll bring you to the appropriate exchange. There's a section on all of these exchanges that you put in, what's your income? What they're looking for is for you to guesstimate your income for that next coverage year. And for retirees, this is really hard when they're living off of an investment portfolio, and you can really help them. What they're including for the Affordable Care Act is they're looking at the year you're getting coverage, and you have to guesstimate your AGI, line 11. That's every kind of income sources, dividends, capital gains, Roth conversions. You're getting an inheritance, and you're taking that as a taxable event. Think of all those income sources, add muni bonds to that. Add the non-taxable portion of your Social Security benefit. So if you have a client that is looking to keep their income low, maybe they want to delay taking Social Security a little bit longer. And then some less common, excluded foreign income, interest from U.S. savings bonds to pay for that higher education, or it's all included. Help your clients budget for that. Now for Medicare, it's totally different. They do a 2-year look back. And you'll notice that's very different from the Affordable Care Act. We're looking at AGI plus muni bonds, but they don't count the non-taxable portion of your Social Security benefits towards your Medicare premiums. Thank goodness, right? So you'll notice differences here that we can help with income planning. Now, you want to take this a step further with your clients. If you click the link in the description below for our healthcare cost estimator, it'll bring you to our planning tools. We've built a healthcare cost estimator to help you sit down with your clients and think about this. All right, client, what's your income? Where are you going to live in retirement? And let's get a ballpark number for what your age 65 Medicare costs are going to be. And hey, we never had the conversation before. We have a section of our tool that's called Medicare Match. We'll help a client get a better match for, hey, should they select a Medigap plan? Should they select Medicare Advantage? We'll help guide them and we'll price the plans in their geographical area right down to the zip code they plan to live in. We also will give you a worst case scenario number for the Affordable Care Act. So if your client says, I want to retire at 60, you can put that in our tool and we'll spit out, assuming you qualify for no premium tax credits, here's what you can expect to pay. Clients need that because a lot of clients don't realize how expensive it is to bridge that gap to Medicare. Also, we'll give you a lump sum number for your lifetime on an estimate for what your lifetime long-term care costs would be. To give an idea to your clients, if nothing else and you're going to self-insure, here's a number that you're going to want to have this earmarked, and here's the risk that you might need a lot more than that. Our tool will help you do that and run scenarios to compare, hey, if we can reduce your income, this is how it'll affect your Medicare premiums. If you move to another state, this is how it's going to affect your healthcare costs. So I would encourage you, check out our tool to help with your planning conversations. Thanks for watching today. Like, subscribe, and turn on notifications so you never miss an update from our team about healthcare in retirement.